Welcome back. Welcome back. Hey, time for another episode of Things My Mother Never Told Me. How's everybody doing out there on Facebook world and podcast land? Tanya, say hey.
Hey, everybody. Thank you for tuning in.
Tonight, we have a special guest on the show, as
Yes,
usual,
we do.
Dr. Brittany Carter-Snell.
Hello, hello.
How you doing?
Feeling great. Thanks for having me.
No, thank you for agreeing to be on. I know you're very busy.
I know.
As we talked earlier before we came on there, Tanya's going to read your bio, and then we're going to jump in and ask you a few questions and let you tell what's going on with you, your story.
Let's do it.
All right, then I'm going to be a little brief. But welcome, Dr. Brittany Carter-Snell. She's a board-certified physician in both dermatology and internal medicine. She's a native Detroiter. She is excited to have returned home to serve her community through the Carter-Snell Skin Center. As one of few dermatologists in the metro area fully trained in internal medicine, Dr. Carter-Snell's unique approach to patient care focuses on evaluating the person as a whole, ensuring inner health while caring for the largest organ of the body, the skin. Dr. Carter-Snell received her Bachelor of Science in Biology from the University of Michigan, Ann Arbor, and her medical doctorate from Michigan State University. She went on to complete a combined internal medicine dermatology residency. That sounded good, didn't it? Through Ohio University and excelled in both specialties. Her leadership skills and clinical performance earned her the honor of serving as dermatology chief resident. While in practice, she has earned the Spirit of Detroit Award and was recognized as an Hour Magazine top doc in dermatology. She is a member of the American Academy of Dermatology, American College of Osteopathic Dermatology, Women's Dermatological Society, Skin of Color Society, I like that, National Medical Association, and the Alpha Kappa Alpha Sorority Inc. She resides in Detroit, Michigan with her husband, Dr. Jamie Snell, and daughter Genevieve. Outside of the office, she enjoys traveling and spending quality time with loved ones. All right, I like everything I just read.
Thank you for getting through that lengthy bio.
That's
I had to give you the clip notes.
yeah. That's her specialty.
I just like to do all that
Yeah,
anyway.
that's her specialty. Reading the bios.
Awesome.
Right. So let's jump in. U of M and Michigan State.
Yeah.
Yeah, that's got to be an internal battle.
It's interesting because I was so focused once I made it to Michigan State on the medical school path that I really feel like I didn't go to the school. I was in the library or in the lecture hall.
Okay.
So I would have to say I didn't have the quintessential Spartan experience.
Okay, well, at least you didn't have to argue with yourself about who's the better school.
There we go.
So, real quick question for you: what high school did you go to?
Marion. It's next to Brother Rice. In Rosser.
Okay. Oh, good. Yeah, we always track our guests' high school career all the way up to professional.
Yeah.
Right. So where do we want to start here? I mean, you got an extensive bio with a lot of awards, and here's one that I like: the Arnold P. Gold Humanism and Excellence in Teaching.
Yeah.
What's that all about?
We have a teaching hospital that was associated with the residency program, included medical students to be able to come in and rotate just to get an idea of what the different specialties were about and complete their requirements for their medical school track. So while an internal medicine resident is where most of the medical students encountered myself. And I did gain a bit of a reputation for being the resident that you probably don't want to get assigned to, because I ask you the tough questions.
Okay.
I felt that I was the patient advocate because so often do I think students get tunnel vision, and,
Mhm.
just like checking a box,
Right.
getting a grade, pass, fail. And I'm like, oh, let's back up here. These are real people in this
Right.
real lives. Let's take this seriously. Let's actually learn what we're supposed to do, right?
Right.
And I think it's because I was held accountable when I was a medical student, and I was just giving them that exact same experience because it helped me to know the information. And when you feel confident in your knowledge, that's when you can actually start to be a real person in front of someone that's hospitalized. You're not really distracted by trying to remember all of your medical information. You can actually relate to them and talk to them like a human being, and
Mhm.
allow them to let down their guard a little bit, not feel uncomfortable while you're staring at them and touching them in a hospital gown. So that was definitely probably why I got the award, because it was tough love.
Okay.
Mhm.
Everything was purely with the intent to make them great future physicians.
Right.
Yeah,
There we
okay.
go. And they need that.
Yeah, and I'm looking at you with this beautiful skin. So how did you choose this profession?
Yeah, I did not know that I wanted to go into dermatology. In fact, I wasn't 100% convinced by the time I made it out of medical school. So that's why I did both residencies. Is that okay? I'm going to start in this internal medicine, and if I feel like this is it, then I'm going to just hold this track.
Okay.
But if I feel like dermatology is still a passion, we're gonna just go ahead and finish this full 6 years of training. And it was definitely those inpatient cases that had rashes that helped clue us into what was going on internally.
Mhm.
I'm not waiting for the CAT scan to give me an answer. I'm not waiting for the test results. I can look at the skin, and that can clue me in as to where I need to pivot
Okay.
in order to help someone, right?
Mhm.
Whether or not their skin is pale. Oh, they may be anemic. Let's make sure we hydrate them. Let's cross-match them. They may need some blood transfusion, right?
Right.
Wonderful.
Their skin is on the bluer side. They may not be oxygenated properly. Let's order a ABG. Let's get the respiratory therapist in here.
I know they close to being dead. They
that visual examination where this organ system is so obvious to someone. If you miss that, then you can't really act swiftly.
Right.
On the outpatient standpoint, I realized that there was a key difference between different ethnic groups and different skin types. And what would look one way on non-melanated skin looks totally different on melanated skin.
Mm-hmm.
And because we didn't really have a lot of textbooks with pictures, with skin of color representation, it wasn't being taught in the classroom, because you teach something about dermatology if you don't have the right visual aid.
Right.
And so that's when I knew that skin of color was its own subspecialty. And as a person of color, I then really felt inclined to make sure that I could go out into the community and help bridge the gap and limit the disparities that were happening, especially because I'm from Detroit, the blackest city.
Right, without a doubt.
Yeah, so it was exciting to be able to go to Ohio and get the training, but I knew hands down I needed to get back to Michigan because that's a population that needed help.
Right, without a doubt. So how was it? Well, I mean, you it's obvious that you got a little bit of intelligence, honors fraternity, Sigma Phi. How was it handling both areas, internal medicine and skin?
Yeah, now it's very helpful. Most of the time I am able to use someone's past medical history and help make a connection as to what they may be experiencing skin-wise. So, you know, just today, young guy, late 20s, a little bit overweight. He's coming in because he's got some rashes on his scalp, behind his ears, rashes on his legs. So I asked him, when's your last time you had your blood sugar checked? He couldn't remember. And he went on his phone, he was able to pull up some records, and he was able to let me know that he was pre-diabetic. I said, sir, people that have higher blood sugar levels are more prone to dry skin. Dry skins are more prone to rashes. That's what was happening on his legs. He also had a yeasty condition on the scalp and the ears. I said, sir, this is another thing that people with elevated blood sugars are more common.
Wow.
You know, exposed to. I said, so I'm going to help you treat this, but you're going to have to help yourself prevent this.
Right.
It's your blood sugar levels very controlled. And now it's a connection, right? Because a lot of times people don't have a motivation to treat a number that doesn't really make them feel bad. But if you are now, you know, looking bad on the outside, now you have a little bit more skin in the game to do something, right?
Right. Yeah. As soon as we start looking bad, that's when it kicks in.
Yeah.
Yeah.
And so it's that internal knowledge about just having that awareness. Okay, what are diabetics more prone to? Nutritional deficiencies. Honestly, one would never even think that so many Americans are nutritionally deficient. People come in for hair loss, and I ask, what's your vitamin D levels? Most people don't care that their vitamin D is low. They're like, okay, you don't have a lot of energy, but what's going to happen if I, you know, feel fatigued? And then I explain, well, this is contributing to why your hair is falling out. And now, even though the internal medicine doctor told them, you take this vitamin D, you know, it'll help you prevent getting brittle bones. But, you know, most young adults don't care about brittle bones right now, but they're going to make sure they keep the hair on their head. So it's those little things where having the knowledge so that you can then translate it into layman terms and then plug it into what the patient actually cares about, I find to be most beneficial.
Okay. And so was like when you were in school, was juggling both areas, was that difficult, or was it just another day at the office?
Oh yeah, it was another day. It was another day. I loved it. I loved internal medicine just as much as I loved dermatology. But what I found was that people were extremely non-compliant as adults. Okay. And I probably got a little jaded. You know, I couldn't see myself just treating high cholesterol all day, high blood pressure, right? But people are very compliant when it comes to things they can see. Yes. Things other people can see.
Right. Right, because we know high blood pressure and cholesterol is a big problem in our community, for sure.
Yes, right.
But for the most part, we don't care either, because like you said, we can't see.
Right. But somebody lose their edges. It's a problem, right?
It's just like me back in the when I was younger. I mean, I'm talking about like 20s and 30s. Well, I started losing my hair in my 30s or 40s. Yeah,
because that's young.
Yes, it was young, and you know our hair is our glory.
Yeah,
that's why we pile it on now. But I end up and I was going to the get my hair done, you know, faithfully every 2 weeks. I had the same beautician for like 20 some years. But what happened was I ended up started getting pink spots in my hair. And my dermatologist, my hairdresser said, you know what, you need to go get your skin looked at.
Wow, that's a really intelligent hairdresser.
Yeah, she said, I'm not going to color your hair anymore. I'm not going to do anything. And she said, you should go get your hair checked out.
Awesome.
And it was a dermatologist. You know, she don't. I was having alopecia. And then she took the biopsy, and that's when she said I had dermoid lupus.
Right. And even then, we didn't have a lot of knowledge. We still don't have a lot of knowledge, right?
Mm-hmm.
We as a community do not like to be guinea pigs.
Right.
Research studies perform.
You're right, because she started
Right.
giving me them steroid injections.
Yeah.
And I'm like, after so long, I'm saying, this is not working.
Exactly.
I'm still not be able to, you know.
Exactly. But so much I've seen so many patients get themselves off of medications when they change their diet and they start going, anti-inflammatory, especially my vegans.
Mm-hmm.
Those are like the main population where they have inflammation one day and then they switch over to the vegan diet. It's like, what inflammation? I have to hand it over to them. I've never been able to go that route.
Right, me neither.
To be committed to that.
Right.
That goes to show that, medicine only plays a small role, does not have all the answers. And, just making sure that platforms such as this that you have, just talking about things.
Yes.
And making sure that people have, access to multiple ways to heal themselves.
Mm-hmm.
Right. Yeah, and I guess you said it. I guess we need to realize that we won't get better if we don't do better.
Yeah.
Definitely.
We know what's wrong, and we'll do the right thing for a minute, and then okay, I feel better. Even though we may not be better, but since we start feeling better, we stop.
Yeah, and the sad part about it too is that we don't practice preventative care. We only do something when everything breaks down.
Yes.
Right. But it's probably just because we just don't have access to people that we feel comfortable speaking to, and also sometimes I think people easily get dismissed when they show up. And you're asked, okay, well, what's your problem? It's like, I don't have a problem, but I'm here to prevent some problems. Like, it's okay.
Yeah, just like you were telling the trainees.
Yeah.
When you were teaching them. I mean, you really have to take that stuff personally and make them feel comfortable. Or else, like you said, they're not coming back. They'll get the prescription for to get the quick fix, but as far as it goes. But just like your vegans, we got to eat to live.
Yes.
Okay, so where do I want to go? Well, here's a question, because I've always wondered about it. How did you find time with all that you were doing to become a AKA?
Yeah, it was the perfect time. I graduated from undergrad a semester early.
Oh, okay.
And at that time, I was helping a family member transition into private practice, and I wasn't starting medical school until that fall.
Okay.
So Alpha Rho Omega, Detroit chapter, they, welcomed me with open arms. And I said, I'm going to be leaving out of Detroit. I got to go to med school. They said, don't worry about it. AKA will always be here. They were right. I really did form some extremely important bonds with these women. And I think that time frame was very helpful too, because not only were there women that were at the same chapter in their life as I was, but it was also women where I wanted to be, right? So women that had families, right? Women that had arrived at a solid point spiritually.
Okay. Yeah.
Women that weren't just going to work, they were pounding pavement in the community, volunteering, right? And so it's always nice to be able to have that type of access, especially as a woman and a minority woman. There's so many that I have yet to meet, and I hope to continue making those connections, because, you know, everybody has something to share and something to teach.
Right, right, without a doubt.
Mm.
So I'll get to that later. Since you brought up family, let's segue real quick and get the elephant in the room out the way. Things my mother never told me.
Yeah.
Now you got extensive bio. You've done a lot of things. You've won a lot of awards. You got a lot of education. Is there something that you've discovered on this journey that your mother either didn't tell you about
Right.
or didn't prepare you for? Put it that way.
You're talking about like health-wise or like life-wise?
Mostly life-wise.
Life-wise.
But it could be health. I mean, anything that sticks out with you. Because what we do is we ask the question of all our guests, and some 70-something guests later,
right?
There's been a pattern of answers that we've gotten, but we've gotten quite a few different ones.
Yeah, you know, I have to say, my mother never complained. She normalized being a physician and being a mother and being a single parent. And I don't know how she did it, right? So things my mother never told me was the truth. How difficult it is, you know, to have so many hats. And so many times do I feel, and maybe other people feel, that, you know, you have to work as if you're not a mother and parent as if you don't have a job. And trying to strike that balance probably is hard to summarize a different generation, right?
Mm-hmm.
Right.
And I do think that maybe nowadays things are just so fast paced and you can get access to things so quickly, and work comes into your home so easily because of mobile devices and computers. And so maybe it wasn't that hard to keep it separated, but, you know, I'm still trying to find, you know, how do you make it all work and still have time for yourself. So yeah, those are the things my mother never told me.
Look, I was definitely more organized when I was younger as a mother and a parent than I am now. I'm like, oh my goodness, I done let everything go.
Yeah, but it's because you probably put in so many hours that you said now it's time to rest.
Right. But you know, I like what you said. Work as if you don't have a family, and parent as if you don't have a job.
Yeah.
That's nice. if we could do that, I think we'd be all right.
And it's interesting too, because you know, for me, I think that the pressure that I put on myself is definitely more than the pressure, you know, other people, you know, put on me.
Right.
When you know, my patients find out that I'm a mom, and I say, oh yeah, you know, there was some sleep deprivation last night. We're going through some sleep regression. You know, that makes me relatable.
Right.
And my daughter, she knows that mom goes to work, and she'll see me in the white coat if I FaceTime her. She said, "Mommy, a doctor?" That's okay. You know, it's okay that my daughter knows that mommy has to leave the house, but she knows mommy will be back, right?
Right.
And that's just life. Yeah, that's just life.
Right. Without a doubt. Well, it's good. Wait a minute. How old is your daughter?
She's 3.
Okay. Oh my goodness.
Yeah,
we knew she was young when she said, "Mommy,"
but right. That's so. Because, you know, we all in your personal business now. Yeah. But you said that you like to travel.
Yeah.
And spend quality time with loved ones. Do you find that hard to do now with her being that age?
I will say that the quality time we have improved upon, because we did make a decision that when we are home, we're at home, and where we're at work, we're at work. So you know what time I got to work today, and when I leave, I'm just going to be at home.
Okay.
Okay, very good. Very
because
good.
I don't take call, right? And so now it feels like that time is more than when I was trying to multitask while, physically being at home. The travel is definitely one that I miss being able to do more often. I just don't trust being in the airline and having my flight not canceled. How do you explain to a whole schedule of patients?
Right.
Dr. Carter-Snell missed her flight.
Yeah, I know.
Well, Dr. Carter-Snell probably should not have waited till the last minute to try and come home.
Right.
And we were able to spend some time for my husband's birthday this year. We actually went on a catamaran. I never have been on a catamaran before, didn't know what to anticipate. I'm from Detroit, but we did not grow up with boats.
Right.
And that was quite the experience in the ocean. It was off of St. Lucia. So because I think it was such a quality vacation, it does not make me feel like I need a lot of quantity.
Okay.
Yeah, definitely.
I can see that.
The water is very healing.
It is.
Yeah.
And so is vacation.
Yeah.
So let me ask you a question. Now we I guess we trying to eke out of this thing. How hard was COVID on you, career wise?
Yeah, it was actually pretty demanding. We were told to leave out of the office and only allow for emergency visits for about 2 weeks from the governor. And during that time period, we went to virtual visits.
Okay.
But as soon as we had the green light to get back into the office, people were ready to come back to get serviced. And we welcomed everyone safely with open arms, trying to be organized about things. And I think that for the first time, things that people may have ignored, but then couldn't ignore anymore because now you have the time because you're sitting at home, you can't go to work. Then, oh, okay, wait a minute, let me do something about this, right? So everyone had more time for themselves to actually make it into a doctor. And then from a cosmetic standpoint, I think Zoom just really caused dermatology to be so popular because now people are, seeing wrinkles and lines and pores on their face that they didn't notice before. And then, thankfully Zoom helped out people by allowing for a filter to happen. Yes, people were coming in even at the height of the pandemic for Botox.
Oh, wow.
Oh, yeah.
And
You don't want to miss them
filler.
injections.
So we kindly obliged right? But it was certainly a time where I felt the most accomplished.
Okay.
Because as a small business owner, as a female minority business owner, we did not feel the strain like so many other businesses. And for that, we're grateful that we still, had our positions here in the city. And we were even employing more people. So now we have like job opportunities for people.
Right.
So that felt good. And I think moving forward after COVID, I don't have any fear because like, how could it even get any worse than what was happening?
Right. That was crazy. That was the craziest time ever. I think the only thing I can equate with COVID, and it wasn't as long a period, but I was much younger, was the '67 riot.
Okay.
So the only thing I equate with as far as stay home.
Yeah. I definitely know
1, 2, 3 years.
No, I said 2 years ago.
Oh, okay.
being in the Detroit area, I made the determination to actually move out of office before they told us to stop the elective cases.
Okay.
hearing the numbers of the hospitalizations that were happening. And thankfully, we had the virtual platform and electronic medical record to be able to support that quick pivot.
Mm-hmm.
I just didn't want to, risk the patients and risk the staff. But, it's one of those instances where you are grateful that Detroit has always been resilient, no matter, what history we've had. We have a comeback.
Right.
Mhm.
Yeah, we always got a comeback story.
We have a comeback. Yeah, we do.
Right. And it is also good that being good at what you do, especially with your observation skills, that Zoom wasn't too bad for you to be able to see things.
Right. It wasn't too bad.
Yeah.
Certainly I didn't feel comfortable if someone had an atypical spot. I can't tell you whether or not that's melanoma or not.
Mhm.
I need to physically be able to examine that with my dermatoscope and
Mhm.
biopsy, sample of the tissue.
Right.
Yeah, okay.
Um,
Getting back to the skin, what's your personal skincare routine? I mean,
oh
'cause your skin is
yeah.
so beautiful, you know what I'm saying? And me,
I-
all I used was basic soap and whatever. I was fortunate enough to have normal skin.
yeah.
But,
I actually use our product line at the office. I know that's very cliche, but we formulated some very nice, gentle products that are safe for all skin types. I have normal to dry skin, and it was important for me to be able to offer things that were non-irritating, but also preventative in terms of aging and pre-cancer and cancerous conditions. And so a lot of our cleansers and our moisturizers are infused with antioxidants. Like, for example, the cleanser I use is a green tea moisturizing cleanser that is safe to use morning and night without drying out the skin.
mhm.
And it does make you feel like your face is clean. I know most people want to have that sensation of this squeaky clean feeling.
Right.
And I also am not a fan of chalky sunscreen. I don't want it noticeable that I'm wearing a sunscreen on my face. So I really like our Ultra Sheer sunscreen. It has a sun protection factor of 50 and higher. The bare minimum is 30.
Mhm.
Higher the SPF value, the more protective it is from aging and cancer. The vitamin C serum we have is a 20% concentration. That's the newest product that I've introduced. This helps with unwanted discoloration.
Okay. Mhm.
And it comes in this little dropper. It's so silky, absorbs very quickly, lightweight, so I don't feel as if I have too much on my face, because I do still wear a K95 at the office.
Mhm.
Right.
And then in my nighttime routine, I use the retinol. The retinol is a vitamin A derivative, and that helps to exfoliate the skin, and it keeps everything tight and plump and smooth and bright. Little goes a long way. I probably use it once a week.
Okay.
So real quick, do me a favor real quick. Share your contact information and website.
Yes, so you can call us at 313-338-8007. You can find us on the web at Carter-Snell-Skin.com. That's CARTRSNELL skin.com. We also are on Instagram and Facebook.
Okay.
And on Carter-Snell Skin.
Watch it. Hey, Brandis, did you get that? she hopefully she's posting it online.
Yeah.
Thank you.
Asked for the information. Yep, she got it. So here's what I want to ask. Because you and I had a conversation when I was in the office, and you were telling me about what is his name? Mr. Reggae Man.
Bob Marley.
Bob Marley.
Yeah.
Could you share that story?
Yeah, so Bob Marley, everybody knows, Black man, who has been able to leave us with good music to listen to, but I think that his medical history is not well known enough. He unfortunately passed away from melanoma of the toenail. And a melanoma is the deadliest form of skin cancer. And many people assume that because it's a skin cancer that it's due to sun and sun damage. And so you would assume that where you find it is in sun exposed areas. But people of color will get melanoma usually where the sun does not shine, such as inside of the mouth, on the palms, on the soles, the fingernails, and the toenails. And so melanoma of the nails can look like a dark streak, as if someone took a black Sharpie and wrote on the nail. And it actually starts to cause cuticle changes and cause local destruction. So he probably could have lived had he elected to do a toe amputation. But because he declined, the cancer did start to spread into the bloodstream and distribute throughout the rest of the organs. So melanoma is not as common for persons of color, but because persons of color are unaware of the fact that it can happen to us, they're unaware of where it can present and how it can present, and because nobody is actually looking for it on it has a higher morbidity and mortality for our community. And so I make it my goal to just explain to people like, hey, you know, it's time to do a once a year full body skin examination with your dermatologist, with your primary care physician. Let somebody get you into a gown, especially checking the areas that are hard for you to see, like your scalp, your back, your butt. You know, encourage your spouse to keep an eye out on areas that you can't see. And so monthly skin exams are now recommended. We used to say, check your birthday suit on your birthday. I always say, check it every month. So the same frequency you would do a monthly breast exam, monthly testicular exam to screen for breast or testicular cancer is the frequency that we say to do for screening your skin for skin cancer.
All right.
Wow.
Yeah, thank you. And so let's get to something a little lighter.
Oh yeah.
I know, because I've never heard of that.
Yeah. No, when she told
Fingernails, I've never heard
when
of
she
that.
told me, that's why I say no. We got to share that information.
Oh my
Yeah.
goodness.
We have to share that information. You won the Spirit of Detroit Award. What year was that?
It was 2018.
Okay. Just short.
18.
Yeah.
Yeah, it was the same time as our 1 year anniversary for the office.
Okay.
And it was a shock, you know, because you build something, you put your head down, you do the work, and you don't expect accolades to come. And when they do, yeah, that feels great.
Right.
But you know, the work doesn't stop there. We certainly just want to be able to have Detroiters access us more and more. So we actively seek and recruit, you know, other providers that have the knowledge base. And so our goal is to, you know, have internal health for external beauty.
All right.
Yeah.
I like that.
You know,
here's a question. Do you have any products or recommendations for skin tightening, such as neck, after weight loss?
oh yeah. Okay. So when you are talking about topical therapy for skin laxity, that really is going to be vitamin A and vitamin E oils and creams. So retinols are the most common vitamin A derivatives that you can get over the counter. The brands that are most popular are Differin, that's Differin. It is marketed for acne, but it is great for skin laxity. Other brands that are popular are by CeraVe. They have a retinol, CeraVe. and La Roche-Posay, they have good retinols. In addition, there are oils that are very soothing, called bio oil. Doesn't smell the greatest, but it is good. But the key is also to wear sun protection, because sun damage actually is the main thing that will thin the skin and cause skin laxity. So there'll be no reason to invest in those type of topical therapies unless you also do the sun protection. Now, when it comes to procedures, obviously everybody knows surgically you can get a neck lift, but the more popular treatments on the market now are microneedling, where there are controlled injuries that happen to the skin. And as it heals, the skin starts to tighten itself, and that can be done safely for any skin type every 4 weeks. People are now also electing for non-invasive radio frequency treatments. That usually requires you to come in every week for at least 4 to 6 treatments in order to tighten the skin. Diet-wise, it's really important to have a lot of healthy fats and omega-3s in order to give that hydration, that plumpness, and that tightening to the skin. And so, fish, salmon is great for skin laxity after weight loss.
Okay.
And so you don't want to wait for the weight to be lost. You want to start doing these treatments as the weight loss is happening, so that the skin can evolve and tighten back during the clearance of the unwanted fat.
Cool. Uh-oh, what did I do?
And I have a question for you also. I was in Aruba and I had one of the aloe vera full body scrub.
Awesome.
It was excellent.
Awesome.
And I was just like, how often should we have something like that?
Yeah, the skin is supposed to self-exfoliate every 28 to 29 days, but you safely help it along as frequently as once a week without causing too much irritation.
Yeah, because that was really, I was like, well, when can I get this again? Because my
Absolutely.
Yes, excellent.
And what's even also good about those type of scrubs is that it's helping to do a lot of lymphatic drainage, and that helps to detoxify the tissue.
Okay.
Yeah, I was like, this is excellent.
Right. So here's another question. Your products that you sell, do you formulate them, or you have some lab do? How does that work?
Yeah, it's a lab that starts with a base.
Okay.
And then they give us the tester, and then we can go back and we can talk to the company and say, can you pull out this chemical? I don't agree with that. Can you make sure that this is a little bit more sheer? I have more skin of color patients. Right?
Okay.
And so it is able to be customized in that way, and keeping things as chemical free as possible.
Okay. Right. Well, I know I can say, shameless plug, but I've used different for the bleaching product, and I've used yours.
Yes.
And I prefer yours.
Oh, thank you. It's less irritating.
Yes.
It's less irritating.
And I got more bang for my buck.
Well, thank you. Thank you.
Yeah. So.
But you know what? There's nothing wrong with starting out with the over-the-counter options, because if it works, that's great.
Right.
But know that if it doesn't, you can always come to a medical office and get something that's just a little bit more effective.
Right. Well, I definitely use yours. That's the one I like.
Hey, another question. At what age should you really start going to see a dermatologist? Is it when you have skin problems, or?
Yeah, most of my patients are plugging in at the preteen age.
Okay.
Because that's when most people are taking an interest in self-care. And the sooner one knows about their skin type and the type of products that are more appropriate for the skin type, the better the outcome.
Okay. And so I'm about to ask the obvious question. The answer is probably, to me it is anyway. What ratio do you have women to men? clients, customers?
Yeah, I would say I think I have 20% men, 80% women.
That's what I thought.
But I need more men. I want more men, right?
Right.
I think a lot of times the women are just helping the men. You know, they come home with the knowledge and they come home with the product. They say, honey, use this. Right.
Right. Well,
I know my husband certainly takes my items.
well, if nothing else, you get more products, so right.
Yeah, absolutely.
Right. So,
you know, traditionally, I see that men don't really start to plug into physicians as early as women will, you know, anyway, and that does need to change.
Right. Yeah, and I right is averse as we are to going to just doctors. Even more adverse to going to dermatologists, unless something, because I mean I came to see you because I had an issue that started bugging me and I wanted to get it looked at. So yeah, we are adverse to a lot of things, and until it, like you said earlier, until it gets to the point where we can see it,
right?
then we start dealing with it. And
right.
so just so everybody knows, you're located on Erskine, just east of Woodward.
Yeah, skin is in the name.
Yeah.
SKINE. Serendipity.
And so it is. Did you make that happen like that, or did just
the Lord Jesus? Won't he do it?
Yes, he will. Yes, he will.
Like you say, all of us say that he like leads and guide and stuff, no matter what we be thinking or saying. We always think it's our idea, but no. Put us in place for a reason. And I wanted to ask another question about moles.
Yeah.
I mean, how can you really, you know, my mole is getting larger.
Oh.
I just noticed it over the years.
Well, you need to see me.
Yeah, because like I said, I was like, I wonder if she can tell if a mole is cancerous or not. I don't, you know.
Right. So evolving moles is one aspect that should trigger anyone to go in to see a dermatologist. So there's something called the ABCDEs of melanoma.
Okay.
So A stands for asymmetric moles. You don't want asymmetric things growing on your body.
Okay.
The B stands for the border. You want smooth borders like ovals and circles, not jagged ones like a star or a splatter. The C stands for color. So usually your mole should be about one uniform color, not multiple colors all in one mole. The diameter is important, D. And then E, evolving. So if something is changing in size, shape, or color, you need to figure out why that's happening. And so biopsies are very easy to do of the moles. They are not invasive whatsoever. Stitches don't usually are not required. It's something that is done with local anesthesia, small sample off to the lab, results back within 1 to 2 weeks. And again, the sooner these things are caught, the better, because if it is precancerous, you just take a little bit more skin around it and then you're done. You don't have to worry about it. But if people sit on it and now it's melanoma, okay, now we're wondering, did it spread to lymph nodes?
Okay.
And so any insurance carrier will allow for biopsies to happen with changing moles. And even if people don't have insurance, there are the pathology labs. They have affordable prices for cash pay customers, right? Our lab only charges $50 to read it.
Okay.
Cool. So if anybody else out there has any issues or concerns, you need to get it looked at.
Yes. Know your ABCs.
Right.
ABCs.
Yeah, because again, the biggest problem we have is the notion that we think something's wrong and we don't do anything. Here's another, is a referral required from a primary care physician for a visit?
Most PPO and HMO insurance companies do not require a referral. You can call and schedule your own appointment. I will usually have patients with Blue Care Network require a referral, and people that have HAP in which, certainly Henry Ford has a large network, including dermatologists. So usually they refer internally. And so there would be no reason for them to come to me unless someone specifically said, no, I feel more comfortable with this position. Most primary care doctors don't have a problem giving that referral.
Right.
Well, I know a lot of our listeners probably have a preference. We want to go to somebody who we feel has a vested interest in the community.
Of course. I want to go to somebody that's vested interest in the community and in me.
Yeah.
Right.
I feel like a number. I want to feel like you actually heard what I said.
Right.
And that you're not dismissing me.
Right. Exactly.
Yeah. You're right, because the other dermatologist,
Yeah.
there's probably a friend of yours, because she was the one that her father was the one that diagnosed me with the lupus.
Yeah. And we call them our grandfather's dermatology.
Yeah.
Okay.
They forged the way.
They sure did, because I'm telling you, everybody, and I'm a retiree from Blue Cross Blue Shield of Michigan. And everybody told me, like, go to them, go to them.
Yeah. And what's really sad is that I don't think enough people know that dermatology programs are very selective as to who they would allow into the program. And so sometimes it could feel like you're trying to join the old boys club. And I think the more and more programs that start to open, or at least more and more programs that have a diverse group of staff members, will allow for more diverse applicants to come through.
Yes.
Right.
Yeah. I tell you, because we're going to overwhelm both of y'all.
It's okay. I'm telling you, we've got people coming down the pipeline. I'm excited.
Oh, no.
Good. Very good.
And they look even younger than I do.
You are so right, so right, so right. Oh, but I'm so glad that we have you. I am really just welcome to the.
Happy to help. Happy to help.
Like you said, it's the biggest, largest organ.
Right.
And I was like, yes.
So question for you, and we're going to let you get out of here. What do you have coming down the pipe? What's next for you?
Yeah. So what's next is allowing for us to expand a little bit more into the Metro Detroit area. So we have pockets of patients, some are true Detroiters, but some are definitely more of the suburbanites. And we want to be able to share the love. So that is on the horizon, to be able to offer those extra location.
Okay.
Yes.
So to be able to reach out and touch someone.
Yeah.
Well, I mean, your office down on Erskine is real nice.
Thank you. Thank you.
And then I found out, because I come real early when I come. There's a sweet shop a couple doors down. I heard it's to die for.
Oh my goodness, I'm so, that's the one thing where I feel that is challenging for people, because you parked and you could just easily walk down the street and get something from the Love of Sugar. That's what it's called.
That's it. Yeah.
After I just had a conversation with you that you probably
about our
sugar. So people are probably like, oh, you put yourself right here on purpose so that people can come with all the acne after eating at the bakery. But yeah.
Right. Well, hey, and I'm sorry. The next time I come down there, I'm going over there.
Yeah, no, it's addicting.
Yeah, they were highly recommended.
Yeah, you might see me over there every now and then. They have some really nice products. The owner, Manal, over there, she was the second place to open after we opened our doors. And I'm so proud of her because she too did not get closed by the pandemic, right?
Mhm.
I guess that was another type of business that thrived. Everybody was stressed out, so they went to sleep.
Yeah, I know.
Well,
Oh.
that area is actually I don't know if you guys were, you say she was the second, so you opened before she did.
Yes,
And so that area, I guess, is really seeing a move.
it is. And you would think that there was more space for people to take, but it's developers that are, sitting on it.
Yes.
And it's not for the underdog all the time. You really have to, I don't know, have some type of connections of some sort. But again, what's meant to be is meant to be. So
Right. I'm about to say, so you telling your secret? That's how you got in there with a connection?
no, the grace of God.
There you go.
and maybe my my ability to relate to people.
Okay.
I'm telling you that always helps because, like you
Yeah.
said, that word of mouth is and you know what? And not too long ago, a couple of months ago, or a few weeks ago, I developed a skin rash down both sides of my leg, my arms, my back, and I don't know if it was stress or heat rash or whatever. But I have to admit, I was using his products from you.
And it worked.
Yeah, I said, here, use this.
Yeah.
Like,
It
oh,
worked.
yeah,
It worked for me. So here, use this.
then we started playing the CeraVe, and it was just back to normal.
Right.
I mean, obviously, if you've been married long enough, you guys have just probably got the same skin type. Huh? So this is what you should do. You guys book your full body skin exams together. We do couple exams all the time.
Oh, okay.
Yeah, I point out, hey, I need you to keep your eye out on this spot on him and vice versa. Can you help me monitor this spot on her?
Mm-hmm.
That sounds excellent.
Right.
That's good.
Yeah.
That's a good idea.
Except, I just had mine, 2 months ago?
Yeah, but that's okay. You can come, moral support.
Yeah. Oh, yeah.
And the next time we'll make sure you guys are scheduled
Together, and then we can go over to the sweet shop.
Because I am monitoring him.
So again, I don't want to keep you. I know you got to get home to the baby and the husband and the hubby.
Oh, she did good.
Yeah. Anything you want to leave our listeners with?
Oh, yeah. I will say that do not feel that you cannot be an advocate for yourself. Do not feel shy to speak up. Do not feel shy to question. Do not feel shy to dispute. Because if you go to a doctor and they get offended by any of the above that I mentioned, that's just not the provider for you, and you can just go elsewhere.
All right. I like that.
Mm-hmm.
I like that. Yeah, because if they get offended, that means they're not listening to you or don't want to listen to you.
Yeah, and nobody should feel offended about a question, right?
Right.
Because yes, physicians are knowledgeable, but at the same time, our job is also to make you knowledgeable.
Mm-hmm.
So there's nothing wrong with teaching.
Right. Exactly.
Ensuring you care about my situation, my problem.
Yeah.
You know what I'm saying? You keep sending me with PAs, but then you got to follow up with me behind that PA.
Oh, don't get me started with these prior authorizations.
I'm just saying.
Oh my goodness. Medicine is so different now. It is so different. If I prescribe something, why are you asking me what the diagnosis is? I know what the prescription is supposed to be used for, but hey, I get it. We're in a position where a lot of people are without health insurance.
Mm-hmm.
In order to get those individuals better access to health insurance, those who can afford their health insurance have to be a little bit more conservative.
Yes. Yeah, I was. I
Access
left.
to healthcare for all.
I left.
Yeah, yeah, yeah. So that's again, you ask questions, call back. Hey, were you supposed to tell me about the results of my prior authorization? You know, what's going on here?
Right.
I was like, did he look over my stuff? But but they had the antiquated system, no system. They still using paper.
Yeah, that's one thing that I did not start out with. We were paperless from the beginning. And it's important to be able to allow patients to be able to access their own medical records. So our EMR system, if you're logging into your patient portal, you can see everything, nothing is hidden.
Yeah.
All right.
They just not getting patient portal.
Yeah. I mean, honestly, it's not cheap.
I know.
They do charge an arm and a leg, but in the end, I think it all works out for everyone because prescriptions are legible.
Mm-hmm.
There's less medical errors.
Right.
We're getting results. Yes.
Yes, that's what I was saying. I was just saying, if you got an office in Bloomfield and an office in Detroit, you all this stuff is in Detroit, but you're not. I mean, in Bloomfield, but you're not servicing those ones that are in Detroit. And I had a problem with that. Yeah. So,
but those are things that, from my standpoint as a business owner, I like to hear about. Please let me know. And you'll be surprised how many physicians actually have things happening behind the scenes that they're just unaware of because they have all these staff members that are supposed to be doing their job and then they're not doing their job.
Okay.
Yeah.
Look, okay.
Yeah.
Well, look, but I love the staff.
Good.
But anyway, but thank you.
What do you think your listeners would have as a takeaway for the docs?
For the system, the doc system?
Yeah.
We got, they vary in age, but I would assume that everybody would want to be involved with a physician that uses that.
Yeah.
Because it's like you said, if nothing else, I don't have to worry about it, whether you open or not for me to get an answer to what's going on. I can just go out into the portal and look.
Accessible. Okay.
Right. It's right there.
Oh, I love it. And like you said, when I didn't even know they even had something like this until I took my aunt, 85-year-old, to her doctor, who came in with a sheet of paper that he did, printed out stuff like that. And I was like, what? I got a chart at my doctor's office this thick.
Yeah.
Right.
And he came in there with that piece of paper and he filled out all of the little stuff, gave me the history of the visit. And he also put it on the thing that let me know, go in and look for this and to schedule appointment.
Right.
And the telehealth is just amazing.
Right. And I wish we could all meet back and have a conversation in 30, 40 years from now, and let's just medical records are gonna be like chips. Yeah. Those my doctor did not have the ability to read my chip.
I know.
Right. The chips that they were worried about with the COVID vaccination, that we'll be using those then. For real.
Yeah. Or the doctor comes as a hologram.
Yeah, but that patient portal, that telehealth, I love it.
Right. And I think the other important thing with it is that when we go home, it's easy to share information with our spouses, loved ones about what's going on, because we can't remember everything that you tell us.
Remember, you're right.
But it's easy enough for them to go out there and go into the portal. Look, here, you can read it.
Oh no, for sure. I mean, I'm looking for my visit notes all the time. I said, what exactly am I supposed to do with this? I mean, I'm listening while you're there, but then I'm on to the next task after I left.
After I leave,
exactly. And then, it was stored in my short-term memory, but not my long-term memory. So yeah, absolutely.
Right.
Yeah, he sent me that little message through the thing, look through here, and I was
I love it. My daughter's a pediatrician, has a patient portal. And, you know, I'm a dermatologist, not a pediatrician. So, you know, we need help too.
Yes.
I'm thinking to myself, I was like, okay, my daughter, she just, you know, got over some ear infection. And like, how soon can she get this COVID vaccine? I don't know. What? Give me some answers. You know? So instead of, you know, picking up the phone because I'm seeing patients, you know, I can log in real quick and send my question and then get a response. That's great.
Yes.
Yes.
So yeah, so that's our take on it.
Yeah.
Yes, I love it. I love it. I love it.
Right. Without a doubt. Okay, so we're gonna let you go.
I know. Let you get home to that baby.
I'm having a ball. Yeah, gotta get home with Genevieve.
Exactly. We'll just be here all night talking about this.
But I love it. I love you. I appreciate you so much for coming on.
Yes. Thank you for taking. Excuse me. I got
and like I said, now I got to make a couple appointments.
Yes,
I'm
gonna hold you to that.
You gonna have to. You won't have to because, like I said, I'm older now, and I'm definitely want to live a little longer.
Yeah, absolutely. We're gonna make that happen. We're gonna make that happen.
All right. So we'll get that set up.
All right.
Yeah.
All right, then, and thank you again.
Right. Thank you for coming on. We really appreciate it.
Have a blessed evening.
You do the same. Thank you.
Bye. Thank you.
Now. Bye now.
Bye. Oh, that was really good. Brandon's in there eating.